Today I want to talk about scarring after the operation, what to expect on the surgical incisions, and what we're going to have you put on the surgical incisions. So immediately after the operation, for the first 3 days, you're going to put an antibiotic ointment like neosporin or bacitracin every time you take a shower. That's an antibiotic ointment basically to help prevent infection for you. After about 3 days, you don't need that. The incision will be pretty sealed. Then just keep it moisturized. If you want to use some lotion, you could do that for the next week or so. Starting about a week and a half to 2 weeks, then we'll start working on some aggressive scar therapy. That would be a topical scar cream like vitamin E, or sometimes a topical silicone product like a Mederma product, as well as some gentle scar massage. So just a little bit of downward pressure on the scar. That helps it soften and helps it flatten out. It'll do that regardless, but that will do it a little bit faster. And speaking about flattening out of the scar, a lot of people have concerns because their scar is slightly raised initially after the operation. Believe it or not, that's how I want it to look. So in plastic surgery, we pay a lot of attention on the scar after the operation. Because for most people, that's how you know how good your plastic surgeon is, based on what the scar looks like. We know scar is a contractor. So as scar heals, it contracts and it pulls in a little bit. So if the scar is completely flat at the end of the operation, a lot of times as it heals, it's going to actually become a little bit inverted. It's going to kind of pull in a little bit. You see this sometimes with C-section scars and things like that. They can kind of pull in to that area. So we know that happens in plastic surgery. So we are taught that when we are done with the operation, we actually want the scar to be everted. We want it to raise up a little bit, so that when the scar contracts, it's going to flatten out. So don't be surprised if the scar is a little raised initially after the operation. That's exactly what I want it to be. That's going to create the prettiest scar for you and the flattest scar for you over time.